Okay, so you guys remember me showing this to you about the daily meds and how you can get all your medications into one little packet. You know, they'll package all the ones in one pack that are for morning, any middays, and any evening pills, and they will package them and send them to you once a month. Well, I want to remind you guys that it's still a very good option if you can get them set right to where they're doing it like they're supposed to. But I want to remind you guys to really look into that, check with your pharmacist, and ask them if you see, they'll come like this. And then they'll have what the medication is. I don't want you to be able to. They'll have what the medication is and what time of the day it is, if it's morning or afternoon. But just remember that this is a fabulous option for us who take a lot of medications daily. It'll just kind of help you stay on track. You don't have to try to remember if you took it, and it's just as good as the pain sorters, not the pain sorters, the pill sorters. It's just as effective as those, except you don't have to sort them every week. You don't have to do anything. They come shipped to you just like that, and they're already pre-packaged and sorted for every day for 30 days. And so I want you guys to kind of be able to take advantage of that if you can. Now, I didn't bring the pill bottles in here for that, but so my PCP sent me to a pain management specialist, and I've been saying that I was going to go to one for a long time, as you guys know, probably since last year. I finally went. I've had one appointment. I have my second appointment next week. But what she did is first of all, she's an anesthesiologist, and she also does pain management. And the process was just a little bit weird. I didn't expect it to be that way. It was my PCP had to fax something to her office, and like with doctor's notes and diagnoses and things like that, before they would even make you an appointment. So you can't just call a pain management specialist and go make an appointment. It has to come from your PCP or your rheumatologist or somebody like that. And so once I got that done, they called me. They made my appointment. I went in, and you have to sign all these forms. And at first, I thought about it, and I said, well, yeah, I guess you do have to, because there's so many people out there that are addicted to pain medications, and so many people out there that get them and sell them as a second income. So they do have, a lot of things that they take you through, one of which is drug testing. They do test you for drugs to make sure there are no other drugs outside of your prescribed medications that's in your system. And with that being my first appointment, she was trying to warn me, well, there's a lot of people that, smoke marijuana for medicinal reasons, and that's okay, but since it is illegal on the federal level and drug control is controlled on the federal level, with pain management specialists, you have to do one or the other. You either going to do the medicinal or you're going to do the pain medication. So you can't do both. So I was like, I don't smoke marijuana, so it's not going to matter anyway. You test all the way, test as often as you want. I don't use any drugs outside of what I take for medication. So they tested me and read it on the spot, and then they sent it off to the lab just to get the second result and to make sure, that it's right and everything. And so I didn't mind that, because I don't, have anything to hide. But I realized at that point, there goes my opportunity to try to do juicing. So I won't be able to do any juicing with the cannabis. I was thinking about it. I had actually was just waiting to go and see this one doctor to get this little cannabis card to see if I could actually do some juicing. But that is not going to be an option for me now, and I've decided it's not going to be an option for me now because The pain meds, I really just didn't want to take a bunch of pain meds. Addiction is always a concern for doctors and everybody else. But think about the patients who have to take the stuff, what damage, long-term effects is it going to have on my body, my organs, and everything like that. What happens if my body gets immune to it. And so all these kind of things ran through my head, which is why I was trying to find a more holistic or naturalistic way to go about managing my pain. But I have to say, I was a little nervous. She was giving me very strong drugs. I was a little nervous, but she did say of the one she gave me, I'm giving you the absolute lowest dosages since you don't have a long history of taking narcotics. So we're going to start you out very mild. Let me know how they do. Then she told me how she wants me to take them. The Tylenol 3s that I was taking like it was candy, she said that's not appropriate for the kind of pain that I'm trying to manage. She said that is actually for mild to moderate pain. Who knew? I was thinking Tylenol was for level 8, 7, 6. She said no. That is only for mild to moderate. So she was really knowledgeable on, and I really appreciated that, because like if you go to like my PCP, if I say, oh, I have some, I think my kidney or something like that is really hurting and da 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 da. Oh, what do you usually take? Tylenol 3. They would give me Tylenol 3. That is not a kidney pain medication. She said that's not going to do anything for that. So she prescribed me. She still gives me the Tylenol 3s. She also gave me Percocet, and then she gave me 15 milligrams of what do they call, morphine. And she told me how to take them to get breakthrough pain relief. And so it made a lot of sense. And for the last few weeks, I had days where I had like zero pain. And the good thing about it, since the dosages were so low, I didn't really get like high and groggy and stuff like that. But man, I could cook, I could clean the dishes, I could vacuum, just, it was almost like a different world not having, level 5, 6, 7 pain. It was like a miracle to me. Okay, so now I'm not dealing with the photosensitivity. Now I'm not dealing with level 6 to 8 pain every day. And so now I'm feeling like, okay, things are looking up. So when I go back, even the morphine is so mild, I don't even really notice it when I take it. And it's the extended release, so it works over an 8-hour period. And I only have to take like 1 or 2 a day. That's it. I don't have to take any more than that. But it's a little bit mild, because when I do my kidney pain, I do have to take the morphine with the Percocet. And that's what she gave me for breakthrough pain relief. Those two go together as a breakthrough. That's when it gets to the level 8, 9, and 10, pain level with the kidney, since I'm having the surgeries and everything. And incidentally, I don't have to get any pain medications from any other doctor. So if I'm having surgery by my kidney doctor, I'm having surgery by my orthopedic surgeon, I just let her know I'm having surgery, and then she just prescribes what I need to get me through the surgery period. So I really like that, because then it's one doctor managing all my pain. I mean, I just love the concept of it. However, she gave that to me for post-surgery, and while I still have the stent in my kidney, because it's very painful. And but God, I hate to say it. I mean, I know it's manufactured drugs, but I am telling you, I have been feeling normal, not having all the pain, to actually be able to do things, wash dishes. I still have to sit down and rest. I still get exhausted and all the other effects that you get from lupus, but it is nowhere near as bad. And I am just loving this pain management specialist. So I don't know if you guys have saw one. I know a lot of people, and one of the things that I was hesitant about is because people feel like they just kind of shove drugs at you. And but hey, if you sit down and you talk to your doctor and they're hearing you, and hearing what you're saying, I think it's worth it to do that, because I forgot what it felt like to not have pain, to be at a 0 or a 1. And that is what I've been at most of this month, even though I had surgery. And it was a very serious surgery, because they had to actually go off into my kidney, you know. And it just feels, almost too good to be true, that I'm not having those level pains anymore, And with lupus, people always expect to have some level of pain, but to have this level of, to have to deal with any level of pain on a daily basis is enough in and of itself, even if it's a 3. But dealing with pain level 6 and above every single day is really, it's depressing, you know. And I am just loving this doctor. She just, she talked to me and she explained to me what the different levels of pain medications really help with. And being an anesthesiologist, people who administer drugs like that, narcotics, for different procedures and things like that, she's more knowledgeable than just a regular doctor who's just trying to prescribe something to alleviate pain, and maybe pain that they've never experienced themselves. So it was really eye-opening for me. But so if you haven't seen a pain management specialist and you're still trying to find the right thing to help manage your pains, maybe you don't want to take it daily. I'm taking mine daily because, I've been in pain for years and I need a breakthrough, and this is my breakthrough. I'm even thinking once I get my lupus under control, maybe at some point over the next few years I can go back to work part-time or something. So I'm really hoping, because I really enjoy getting out and being around people and stuff like that, because I like to cut up and act crazy, as you guys can see. But this has gone way too long. I'm 12 minutes already, so I'm going to upload these videos, and then I'm going to try to update you guys next week, especially since I have some appointments next week. I go see my neurologist, the one that prescribed the medication for my photosensitivity. I see him on Monday, and then I go see my pain management specialist on Thursday. So I'll give you guys an update. Not sure if it'll be 2 or 1, but I'll definitely do another update to let you guys know how it goes. And be sure to keep in touch. I've missed you guys. Deanne Marie, Angie Lupus Life, everybody. I know she updated me on Tremia, just everybody. I just have been I've just been feeling so good that I've been acting like I don't even have lupus. So at any rate, I love you guys. I miss you guys, and I will be in touch more, since I'm not in and out of the hospital as much now. So I'll talk to you guys soon. Bye bye, loopy lovies.